The immune system is the part of the body responsible for preventing infections. The immune system is so effective in preventing illness that we are not even aware of how many diseases it has successfully protected us from. It is also responsible for eliminating infections when they do occur. Cancer occurs when a normal cell loses the ability to control its growth and keeps dividing into more and more cells. Because the cancer cells originate from normal cells, some of the methods the immune system uses to detect foreign substances do not work and prevent the immune system from recognizing the cancer as something to be attacked. Cancer cells can often also gain the ability to resist the signals that might cause a normal cell to die. Cancer cells often develop methods to avoid detection and destruction by the immune system. Immune therapy, or immunotherapy, is treatment aimed at boosting the immune system, especially the existing response to cancer cells.
Immunotherapy has been used against cancer for some time, but as we understand more and more about the immune system in cancer and how they interact, we are able to develop new therapies. There are many types of immunotherapy. Some types are given after surgery in order to destroy any remaining cancer cells. These after-surgery drugs include some natural substances that immune cells normally use to signal each other. They boost the immune system in certain ways unique to each chemical signal. One example of this is interleukin-2, also known as IL-2. Another drug that boosts the immune system is interferon, known as IFN-alpha-2. Ipilimumab, or Yervoy, has another mechanism for boosting existing anti-tumor cells. What we just described were drugs used as additional treatment after surgery when the cancer has been completely removed. This is called adjuvant immunotherapy. Immunotherapy may also be used when the cancer cell has become more advanced. It has spread to other parts of the body. One of these treatments is delivered directly into the tumor or into the lymph node, the location where a lot of immune cells collect. These injections usually occur every 2 to 3 weeks, and treatment can last 6 months or longer. Your healthcare provider will decide which tumor or tumors to inject and may not inject every one. The drug in these injections, known as TVEC or Imlygic, causes the cells near the injection site to make another natural substance called GM-CSF. This drug uses a weakened form of the herpes virus that commonly causes cold sores to get the drug directly into the tumor cells. Care should be taken to prevent spreading the virus to any place else on your body or to others. The main steps to prevent spread of the virus are to keep the injection site covered, place any used dressings and cleaning materials into plastic bags and seal them before disposal, and to wear gloves while putting on or changing your dressings. The immunotherapy drug ipilimumab, or Yervoy, that we discussed earlier, can also be used at this point in the melanoma progression to boost existing anti-tumor cells. A different type of immunotherapy drug blocks one of the ways your melanoma may have developed to avoid being attacked by the immune system. These drugs are known as PD-1 inhibitors, also called nivolumab or Opdivo, and pembrolizumab or Keytruda. All of these treatment options attempt to boost a person's natural immune response to the melanoma. Different people have different natural responses to the melanoma and may get different results from immunotherapy drugs even when they have a similar type of melanoma and the same amount of disease. These drugs are injected at your doctor's office or at the hospital.
It is important to talk with your doctor about your treatment options. Doctors know a lot about many things, but they may not know your most important healthcare concerns. Asking questions not only ensures that you understand your care, but also lets the healthcare team know what is important to you. Preparing a list of questions to discuss with your healthcare team may be useful.
Dr. Prime, I have some questions for you before we get started.
You should start by asking the questions most important to you.
These drugs have side effects. John, we discussed some of the potential benefit of treatment, but now let's have a conversation about the side effect possibilities.
Yes, Dr. Prime, I do want to understand my options and the side effects of each of the treatment choices.
Some side effects may occur at the injection site, while other side effects occur because of the activated immune system. These may involve any organ or organ system. So, John, it's important to discuss any changes or any new symptoms you may observe with me and your healthcare team while on treatment or even after your treatment has ended. This may not result in me, as your doctor, stopping the medications completely, but may indicate that you may benefit from modifying the treatment in some way.
We hope this has been useful to you. Please take a moment to give us feedback by answering the following question.